Hello my beautiful friends and welcome to fibamu. I'm Inga, physiotherapist, and in today's video I'll show you how to successfully treat your shoulder impingement. In this video you'll find the following. Firstly, we brush over the anatomy of the shoulder impingement quickly. Then I show you a self-assessment test, the painful arc test, followed by a nerve mobilization technique that has actually proven to really make a difference in the treatment. And then I show you 4 exercises that you can easily incorporate into your day, with the last one being my favorite, so stick around for that. So the shoulder impingement syndrome is believed to be the most common cause of shoulder pain, accounting for roughly 50% of all shoulder pathologies. A shoulder impingement occurs when the outer edge of your shoulder blades, which we call the acromion, rubs against, for example, your rotator cuff muscles. It impinges on them and irritates them. Sometimes it's also irritating the bursa, which is a fluid-filled sac around here that helps for everything to move smoothly, and this can also get impinged and cause pain. The problem with the shoulder impingement is that it's a vicious cycle. There's already not a lot of space between your acromion and your humerus, which is your upper arm bone. If this impingement or rubbing of the acromion against your rotator cuff muscles or tendons occurs, these get irritated and inflamed, leading to a swelling which even decreases the space further and thus making the impingement syndrome more painful. And around and around. What are the symptoms of shoulder impingement? The onset can be very suddenly or also gradually. Often you feel a pain on top, on the outside of your shoulder. It might keep you even up at night and you have particularly problems reaching overhead. Sometimes we also see a weakness in the affected arm, but what we typically don't see is a stiff arm. So if you're experiencing stiffness in the arm, it points us more in the direction of frozen shoulder. So make sure to check out also our video where we test 10 different shoulder pathologies. I'll link it up here for you. Who gets a shoulder impingement? Often we see it in individuals that do a lot of overhead activities. This can be in sports such as tennis, or if you do swimming, everything where you have to lift your shoulder repetitively high, but also in manual labor that involves overhead activity, painting, changing light bulbs, everything where you have to often be in that position and might irritate the tendons of your rotator cuff muscles. Other onsets could be injury if you fell onto an outstretched arm and decrease the space here further. In general, wear and tear as we get older, and very important, poor posture. Try, if you are in a good posture, to lift your arm. If you are in a poor posture, so you're rounded forward, lifting the arm becomes very difficult in general. It's because the space that your tendons have running here is already decreased, okay? So posture is also very important. So let's do our self-assessment test, and we're doing the painful arc test today. For that, please come into a standing position and place your arms next to your body. From here, you're going to draw a circle and bring your hands overhead, okay? A positive test is if you usually don't experience pain for the first 45 to 60 degrees, then you enter a painful range, so the painful arc, up until 120 degrees, becomes usually pain-free again, and sometimes you also feel a pain in the end range between 170 and 180 degrees, okay? You can lower back down your arms. So if the test is positive, what can you do or what should you do? Well, if it's really acute and really inflamed, I would suggest that you rest and cool it down a little bit for the tendon to decrease a little bit in swelling. But once you are able to move a little bit more freely again, there are several things we can do. Let's start with a nerve mobilization. For the first nerve mobilization or nerve flossing technique, please elevate your arm from the affected side into this position. From here, bring your hand towards your head and bend the head away. Now you're going to move the hand and the arm together in this motion. So we're flossing the nerve without putting too much tension on both sides. Okay? The next step would be that you move them away from each other. So you bring your head towards your hand and then move them into opposite directions, bringing even more tension on that nerve. Okay? And then you can also repeat that motion. Okay? If it is too painful for you to have your arm in this position, you can also hold your arm a little bit lower in that pain-free area, okay? And repeat the exercise here. It's really quite amazing what a difference this exercise can make, and studies have really proven that, so I encourage you to try these. Next up are our 4 exercises. So we want to focus on strengthening the rotator cuff muscles, so all the muscles around your shoulder blade that help stabilize it. We want to work on your trapezius muscle, serratus anterior, and in general, your core muscles. The first exercise I will show you is the scapula squeeze. This is really a simple exercise that you can even easily do on your desk or while watching TV. You simply, as the name suggests, pull your scapulas together. Pull the shoulder blades together as if you want to hold a pen between them. Hold this for about 5 seconds and then relax. Repeat this exercise for about 10 times, as often as you like throughout your day. Our exercise number 2 is the scapula push and pull. Find yourself a spot on the wall and place your hands onto the wall. From here, you're going to bring your shoulder blades inwards and then push them back out. And you're going to repeat that, really trying to work with your shoulder blades as much as you can and not so much with your upper back. You can also do the exercise standing if you like, if you feel like you have more control over your shoulder blades, or you can also do this exercise in a kneeling position. I also recommend to do this exercise for about 10 repetitions. Our exercise number 3 is a chest opener. So we want to open your chest and stretch your chest open to get more space between the acromion and your humerus. If you remember, if your shoulders are hunched forward, you have less space to move your shoulders, so we want to stretch the muscles in the front to help you gain back pain-free range of motion. For our third exercise, please find yourself a spot between a door. You're going to place both hands on either side of the door frame and you're going to step forward with either foot. Then you're going to lean forward, opening the chest and so opening the area where the impingement is taking place, okay? So again, lean forward and just enjoy the stretch and stay here for as long as you like, maybe 10-15 seconds, and then release the stretch and repeat it 3 to 5 times. If you do not find a suitable door, you can also find a corner of a wall and simply place your arms outstretched on either side of the walls and then stretch towards the corner. And our last exercise is a hanging exercise. It is really my favorite exercise to help with shoulder impingement. Hanging is really extremely beneficial, and I'm going to show you this exercise with a bar and afterwards also with a door if you don't have a bar available. So if you have a bar in a gym, on a playground or at home, you're simply gonna place your arms up on the bar, or you grab it with your hands, and then you're going to slowly increase the weight your hands are carrying, so slowly and gently decrease the amount your feet are taking. If you're not comfortable letting go with your feet all the way and hanging completely, that's totally fine. You can stay connected with one foot and help carry the load, okay? But if you are comfortable, just hang here for as long as you can. There are studies that are suggesting that 10 minutes are super beneficial, but if you can't make it to the 10 minutes, that's also totally fine. Maybe work your way up slowly, start with 1 minute or 30 seconds and then slowly progress upwards, okay? Again, this is extremely beneficial. It's opening up all the space that your shoulder needs, and it's also a super decompression for the spine. So if you suffer from back pain, this is also a great exercise to incorporate. Again, if you do not have a bar available, that's no problem. You can also do it on a door, but please be careful that your door is stable enough. So you can place your hands on top of the door. If this is uncomfortable for your hands, put a towel between the door and your hands. And then again, just slowly start to hang, so slowly take the weight out of your feet. If you dare, you can lift your feet, but also no problem if not. You're still getting a great decompression of these rotator cuff tendons and what's causing your pain, okay? So I hope that helped. Hanging is really extremely beneficial and one of the functional movements that we have done for centuries. So I really encourage you to try it, and I really hope it helps you. And now you made it until the end of the video. I hope you enjoyed it. As I said, I hope it helps you. Don't forget to like and subscribe, and then I hope to see you here again soon. Bye.